Excellent. So once again, I'd like to welcome you all to our Young and Brave workshop series. Today, we are going to be talking about a very important topic. It is a topic that affects us as women, and a very, very important one as well. So today we are going to be addressing, okay, today we are going to be addressing women's health issues, okay? So one thing we've realized is that biological and gender-related differences have a significant impact on men and women's health. The health of women and girls is of particular concern because in many societies, they are disadvantaged by discrimination rooted in social cultural factors, such as unequal power relationships between men and women, social norms that decrease education and paid employment opportunities, an exclusive focus on women's reproductive roles and potential or actual experience of physical, sexual, and emotional violence. Women's health is positioned within a wider body of knowledge cited by, among others, the World Health Organization, which places importance on gender as a social determinant of health. While women's health is affected by their biology, it is also affected by their social conditions such as poverty, employment, family responsibilities, and this aspect should not be overshadowed. Women, and I believe you guys can testify to that, traditionally have been disadvantaged in terms of economic and social status and power, which in turn reduces their access to the necessities of life, including the health care, among so many. So the gender gap in health is even more acute in developing countries compared to where we are right now, where women are relatively more disadvantaged. In addition to gender inequity, there remain specific disease processes uniquely associated with being a woman, which creates specific challenges in both prevention and health care. Women experience unique health care challenges and are more likely to be diagnosed with certain diseases than men. Chronic diseases and conditions such as heart disease, cancer, and diabetes are the leading causes of death for so many women. And even this year alone, I've heard people that I do know die because of cancer, and it's such a painful experience to hear of young, old, irrespective of age. These are one of the challenges that women encounter and face. And research has actually shown that about 38% of women suffer from one or more chronic diseases compared to 30% of men. There is a famous slogan, I believe you guys must have heard about it, which says, healthy women and healthy world. And this embodies the fact that as custodians of family health, women play a critical role in maintaining the health and overall well-being of our community. However, because of the many roles that we play, we also focus more on the health of our spouses, of our children, while neglecting our own needs, and this should not be right. So it is very important that as women that we take time to maintain our health, to maintain good health. In fact, a number of illnesses that affect women can actually be prevented with proper women's care as a priority. In other words, if we put ourselves, our health care, a priority, most of these diseases will be prevented. At every stage of a woman's life, there are important preventive healthcare steps to follow in order to provide early detection of medical problems. And the problem is that many women neglect healthcare exams for a number of reasons, to give one excuse or the other. But after putting so much energy into caring for the life of others, it is imperative and it is time for us as women to put that same level of care towards taking care of our health, towards taking care of ourselves, because if you're not able to take care of yourself properly, you fall sick and you're not going to be able to take care of other people, you maybe your children or whoever it is that's been placed in your sphere of influence. And that is why we have chosen to have a workshop to educate women about these prevalent and important issues that affect our health. So today we are privileged, and I'm happy to introduce, she is my friend, Mrs. Indawe Kai. I guess I didn't pronounce it properly, I'm pronouncing like a North American, was born in Asian Central, in Edo State in Nigeria, where she attended Our Lady of Lourdes Girls Secondary School, Romi. She graduated in nursing, midwifery, and post-nursing health education at the University of Benin. She worked for 6 years at the University of Benin Teaching Hospital before she relocated to Canada some 2 decades ago. In Canada, she has worked in 3 different health authorities, including 10 years in ICU at the Vancouver General Hospital, an emergency room at the Interior Health Authority. Currently, she works with the Fraser Health Authority, and she's also the director or administrator of a mental health or substance abuse rehabilitation program-owned business. Mrs. Ndaweka is a professional nurse, a businesswoman, a mentor, a wife, and a mother to 5 wonderful children, of which 2 are participants of this mentoring program in the youth category. So her children are actually participants in the beautiful program. Above all, she's blessed and privileged to have Jesus as her Lord and Savior, whose mercy and faithfulness she stands. So I'd like to welcome Mrs. Ndaweka over to take over and educate us on women's health. Let's welcome her. Over to you. Can you unmute yourself, please? We can't hear you. You're still muted. You can just click on the, see the icon that has, let me see if I can unmute you here. It's not letting me, let me go over here. Participants, see if I can unmute you here. We cannot hear you. Okay, let's see if this will work. It's not allowing me to mute you.
Unmute.
Okay, that's better. Excellent.
I've done it now. Yes, unmute.
Okay, excellent. So go ahead.
1 second, it's covering the screen.
Okay.
Okay. Okay, can you, all right, can you hear me now?
Yes, perfectly well, thank you.
Good evening, my fellow ladies, and it's a privilege to be in your midst today. I will be talking on the physical health that affects women. Just like the producer or Mrs. Dr. Blessingly has said, we tend to be caretakers of everybody, and then we neglect ourselves. It is true, and it's a struggle to balance this equation as being that is the unique role that God has actually given us in life. So today, amongst all the many diseases that affects women, like she said, and it's true, by being a woman, there are certain you are at a disadvantage somehow when it comes to health, because there are certain things because of the hormones that runs our system that predisposes us to diseases that will not affect the man. So I will start by saying that, and that is why, I can say, or we can, in every, it's an agreed statement that the health of a woman actually defines the health of a nation, because she is the mother of the nation. So if you have healthy women, then you have healthy nation. That is why the WHO is very, very interested in the health of women and children, because the kind of women you have are going to determine the kind of society you have. The kind of children that you're raising is what eventually creates the nation that is prevalent where you live. And also, like she said, yes, it is true. The state of the nation that you live also determines the health of the women that lives in it, which unfortunately, most women, like in the developing countries, have a lot of disadvantage when it comes to health. Everybody does, but I think it's more, the situation is worse with the woman and the girl child. The situation as it is, there are many things that we will say that affects women. WHO, like I said, are very interested in the health of a woman because the health of a woman determines the health of the nation. So I will say that what is health? The definition of health, according to World Health Organization, is said is a state of complete physical, mental, and social well-being, and not merely the absence of a disease or infirmity. What does this mean? It means that the fact that you see me working like this or looking like this doesn't necessarily mean that I'm healthy, because it goes beyond your physical look. It goes beyond your appearance. Because as women too, we are always very good at trying to, put up fronts. We never show the true state or situation, even when that is whom we are made to be. So that means that it includes health. For you to say you are healthy is like having, you must have complete healthy mind in a healthy body. And how is this possible? It sounds like something that is almost not possible unless you don't have responsibility for anybody. But even if you do, that's probably maybe in your early years that you have not grown to have all the maturity, all these hormones mature and run in you. But once they start to function, there are certain things goes beyond your control. So there are other things like that. I also said that, being a woman or being healthy, it's you quantify the person in wholeness. That is you as a whole, and then you as an individual. You as a whole means the you that reflects in the community. You that reflects in the family life. It entails your family ties, whom you are, your ancestral background, the community you live in, and all those things. Then your individualism means you as a person. So how are you, and what are the things that makes you whole? So that is why in the hospital, for instance, in the hospital setting or in health, when you are treating somebody, you don't just treat them as an individual, because you know that they are a part of an entity. So you treat them, the one person who is well, there are so many ripple effects that will happen as a result of the woman not being well. So you put so many things into consideration. That is why when you're being treated, they don't just treat the physical condition that brought you in. So many other things are put into consideration, as your home, who is responsible now that you are here, who is responsible for the children that you left behind. It's not time for this. It's not time. Yes. I'm not sure what's happening.
You might want to unmute the other one, because you have two. Are they close together? Your computers, are they close together? I am just going to pause.
Yeah. So please give me 1 second. Let me log off that. And I just wanted to make sure this will work. Oh, that's good. Yes. Yeah. So as I was saying, that like the human being, like the wholeness is your social interaction and community through family. No, it's not time for this yet.
Not yet? Okay.
No, not
so
yet.
Let me know.
Okay,
let
thank
me know when
you.
the time comes, okay?
Okay. So yes, social interaction and community through family setting that you come from contributes to part of your health. And then your individual person, like I said, your body and mind, the wholeness of your body and mind. It's also a determinant of your health. So essentially, like I said, a healthy mind in a healthy body is a perfect scenario, but our focus is on the physical health of the woman today, because there are too many. The woman is a very complicated being. So, but we are going to try to focus on the physical health of the woman. And when you also talk of the physical health, it's a lot. It's too diverse to begin to want to squeeze into an hour. So what I have done is try to maybe just break it down very quickly, and I will concentrate on one common thing that I know that is a big concern for a lot of women.
Mm.
So I staged it. So I put it in various stages, as in post-pubertal stage, which is the 20 plus. I know that this category of women is 20 to 40 years of age. This is the whom the emphasis is on. And these are actually the people that we need to empower to get the kind of society and to get the kind of health influence that we want on our children as well, or even ourselves, because these are the ages that projects what the nation really is. They are the vibrant group. They are the ones that are outgoing. They are the ones that are the innovative stage of their lives. So at this stage, I did say that it's the stage of confidence, admiration, and expression as a social being in a community. That is when you're gaining your confidence, because at this point you are educated, you are getting a job, you're beginning to have your own self-definition of whom you are, and you're creating that sense of self. At this stage, from 20 onwards, even on into your mid-20s, depends on how the society is, even in your 30s, if it's in developing countries, before you start to think of what you want to do with yourself and whom you're going to live your life, share your life with, and all that. So the health issues that are prevalent in this stage of life, which also cuts across the other stages, are things like dysmenorrhea. Dysmenorrhea means like menstrual pain. Then menorrhaea. Menorrhaea is it's a condition where you have excessive blood flow during your periods. Then there's something also called metrorrhagia. Metrorrhagia is having periods in between periods. You find that you would have had a period, but it's not up to. Periods should be within maybe from 21 days to 28 days is normal. Sometimes it should be like 28 days or 21-day cycle. But you find some people, they had their periods 2 weeks ago and then they're having another one again. When you have that, please, there is a problem. You need to seek medical advice. If you're having excessive menstrual pain, you should please seek help, seek medical help. Or you are having periods in between or excessive bleeding, you should seek help. Then also there is also the next phase of the woman's life is pregnancy. The stage of pregnancy, like when you are pregnant, what are the things that becomes the physical health, the physical image that you, or physical concerns that you will have while you are pregnant. As a result of pregnancy, our bodies expands and expands beyond, and basically you could say disfigured, but it is a blessing. But some people struggle with their new look. Then there is, like I said, that's body image. Then you do have symptoms of pregnancy, like striae gravidarium. It would feel like a line that goes from, depends on the stage of the pregnancy. The line goes from, eventually will go from below your xiphisternum to all the way to your symphysis pubis, which is below, almost at the tip of your vagina. We are all matured audience, so I'll be free to use whatever term that I need to use, okay? So yes, that line will go on. It's like a dark line. It's as a result of hormone that this is happening. So, but some people may struggle with that. And then of course the weight gain, and then issues like diabetes and hypertension may creep up as a result of pregnancy. It is not your fault. Sometimes the diabetes will come up because there is a hormone in the placenta that is anti-insulin, that inhibits insulin synthesis. So by that time, you will hear that some people will say, oh, they have gestation. It's called gestational diabetes if it's happening in pregnancy, but it should normalize as soon as you have your baby and the placenta is out. Your insulin regulation should be back, because what was inhibiting the hormones from what was inhibiting the insulin has fallen off with the placenta. So if after pregnancy your diabetes situation does not normalize, of course you continually need to be followed by the endocrinologist, who should manage this. Then hypertension could result, as a result, could come up at that point, not because of what you have done, but because of the impact of the baby. It's there's something called, it's too vast for me to go into, but you could just simply say hypertension in pregnancy, or pregnancy-induced hypertension. It's a complex situation that is as a result of the hormones that is also secreted during pregnancy. It's the impact of the baby. Sometimes it could be, it's too complex, like I said, for me to go into, but in pregnancy, it's called, you hear some people will say, oh, they have when they have hypertension in pregnancy, there are steps that you need to take. Of course, if you're being followed by an obstetrician, they would make sure that there is also an internist that is following them to make sure that the baby grows normally, because you are the one feeding them. So if you have narrow blood vessels that is going through to their placenta, then they're not going to get good nutrients. So they may not grow adequately. So all this being said, whether in pregnancy or in normal life, we are still predisposed to this. In a later stage in life, it's only the grace of God that will make a woman not to become hypertensive, not because of what she has done, but because of the hormone control. By the time your hormonal, like the estrogen, it's by the time your hormonal control starts to it starts to dwindle down, there are certain diseases that just ordinarily comes. The woman is predisposed to cardiovascular health, because cardiovascular issues, because at that point, when you are still young, you secrete a good amount of estrogen and progesterone. But by the time you're going older, this estrogen and progesterone, because progesterone, for instance, relaxes, it causes relaxations of the muscles. So the same thing happens in your arteries as well, and your blood vessels, when you are in normal life. But by the time that your hormone starts to dwindle, then what is happening is that that relaxation that used to happen in your arteries is no longer occurring. So then what will now happen is that your blood vessels now start to toughen up. They are no longer relaxed. So what they do is, like, they are in constant states of restriction, and that causes narrowing also through where the blood flow goes through, which is the vessel in the lumen. Is sort of like this. Like if you have a vessel, it has a hole that the blood flows through. If this is not relaxed, it's like a balloon. If you have a bloated balloon and you have water trying to go through, you have a lot of water trying to be able to go through. But when you collapses it, then it becomes a trickle that can go through. So it's the same thing that happens in the life of the woman, which unfortunately men don't they don't go through this process. So that is one thing. And then, of course, diabetes as a result of weight gain or things that we go through in life, it's also hormonal control that could cause that. But there are things that we can do as women by either by taking charge of your health. I'm hoping that we'll have time to get there later, that you can do to prevent these things. Then the third stage is the postpartum that I put it, or perimenopausal stage. People, when you hear menopause, you think, oh, it's meant for older people. It's when you are getting older. I don't have to worry about that right now. But actually, no. The perimenopausal stage it's a phase of 10 years. So it's 10 years of your body going through this gradual process to before the hormones actually ceases. Menopause is described as a period of you not having a period menstruation for 1 year. So many things happens during this stage. 10 years prior, it could be that your period starts there, it's not being as regular as it used to be. It's probably not the number of days that it used to be. It's not as heavy as it used to be. It doesn't come when it's supposed to come. It becomes irregular. You find that you're not, your sleep pattern is altering. You find that your mood, I know there is another thing for mental health, that they are sort of interconnected, because these are things that you will see that will manifest physically, that you'll be seeing. And then by the time you start to find that you're not able to sleep properly, and then you start to have things like migraines, which is just a nagging headache that doesn't go away. Some people, it could honestly, it could be debilitating, that they are not able to function. They are just there like for periods of the time that it comes on, they can't function. Some they can't just stand the light. They want to be in a dark place. They just want to just rest and stay away from light and stay away from everyone. That one is one of the things. And then there are things, anxiety. People end up with anxiety, like they just find that they have a state of losing control, basically, you can call it that. They just feel overwhelmed, and they feel like there's this flood of emotions that just could lead into panic, and they don't really know, but it's an extreme overwhelmingness that happens to them without, they can't put a finger to the cause of why it is happening. It's not your fault. It also it could be due to your hormones that is winding down, so you suffer from these things. And then anxiety too could lead, depends on what the trigger is, could lead to psychosomatic disorders, which is a term in psychiatry that is used to describe a situation where you will find that a person, honestly, in some cases, if it's if they're predisposed to stress because they've a case of infertility, they actually can manipulate themselves. We say manipulate, but trick the brain somehow. The brain they will find themselves pregnant. They will look pregnant. They will start to manifest all the symptoms, signs and symptoms of pregnancy. There will be nausea there. Their stomach will be protruding. But then when they go in to see an obstetrician, they will tell them they're not pregnant. They'll go, I don't know what is wrong with you. I know I'm pregnant. But this is what that is. It's amazing what our bodies can do. It depends on the level of stress that the people are predisposed to. And I've actually seen one. I have seen a woman with a pseudo pregnancy after so many, it's called pseudo pregnancy, when after so many years of infertility. And of course, unfortunately, it's a terrible thing back from where we are coming from in Africa. Almost in every country in Africa, is the woman is vilified, and so many things. She suffers just because she's not been able to get pregnant. Even when they don't put into account that it's not, the woman is not supposed to just make herself pregnant. Somebody is supposed to make her pregnant. But no, the men are always exonerated most of the time. It's the woman's fault. So because of that, for whatever reason, this woman honestly was looking pregnant by every standard, but until 9 months came, no baby. So even here, I was saying it happens too. What you will find here is that when they go for ultrasound, Yes, she will look pregnant by every standard, but there is no baby in the uterus. It is not demonic. It's not a demonic attack. This does happen. It's called psychosomatic disorder. Some people can start to manifest seizures. We call it pseudo seizures, like convulsions. They will be convulsing. Everything will look like convulsion, but when you do an EEG, you have an electronic picture of their brain when this activity is going on. There is nothing happening in their brain, but their body is twitching and they are manifesting everything that looks like convulsion. This does happen. It can happen as a result of extreme stress. It's part of a psychosomatic disorder. And then it's just the fibromyalgia is another condition, which is like people will just tell you they have body pain. It's multiple symptoms that you can't put a finger on it as to why this person is presenting like this, but they know they have body pain. They have body pain. You can do MRI, you can do this today. If it's not arthritis, tomorrow is headache, tomorrow is this, tomorrow is that. They can't get out of bed. They are just debilitated. So that too, sometimes they treat it as a psychiatric illness, that is what works. So they'll give them all kinds of medications. So you need to know when that is happening. And of course, I already described migraine. Migraine also could be that. Then fatigue. Fatigue will just be a state of just extreme tiredness. You're tired all the time. You can't really point a finger to why you are this tired. But if that is happening, it could be a symptom of psychosomatic disorder. But if that is happening too, you should get your thyroid checked out, because sometimes your thyroid can just really put you to a stop, that you find that you are just not able to get it. You are so tired. So you get your thyroid check if you're getting too tired, or even when you are not able to sleep too, it's still hormone. It's still hormones. So if it's too low, people can get depressed. People can be in very depressed mood. If it's too high, then there can be hyper and so many things. A very small gland. Blessing, please. Are you able to increase my screen? You on the bigger screen? Yeah. Can you hear me?
Screen? I can't increase your screen.
No, you are the one that is in the bigger screen. So you can put me to be on the major screen.
Oh, okay. I'm not even seeing the screen part. Let me just see. So the speaker part? Oh, yes, so I'm the one you guys are seeing here? No, you're
the one that's, I think so.
Yeah, I can see you. Okay, maybe what will happen is that I'm going to put myself on mute, because I believe that whenever there is a sound, wherever the sound comes from, the person shows on the screen.
I see.
Oh, she said that Mrs. Theory said that you are the one on the screen.
Oh, really? Okay, I'm seeing you. Okay, let's go there. Okay, yeah, it's because I was trying to show them where the thyroid gland is. So I'm thinking, I don't know if they're seeing it.
No, I can see it. I can see it.
Oh, you can see it. Okay. Yeah. Okay, so like there are two. They are right here. They sit on this here. There's a cartilage that is right here. So they are here. So if there is at times also like so many things that this can cause, even the diabetes that we're talking about. If you have low thyroid level, your thyroid hormone, if it is low, you can become diabetic because it slows down your metabolism. Therefore, whatever you eat sits in your bloodstream. It will not it doesn't tell that organ that is supposed to release the hormone to digest the sugar. So it just stays there. Then your energy level is depleted. Then so many things can happen because of that. Your mood becomes low. Everything becomes low if these little organs, hormones are low. But at the same time, if it's too much, then you become hyper. You find that you can't sleep. You can't, you're hungry all the time. People's eyes, it can also become cancerous. So when you look at when you are part of examining what's of your own body as a woman, you should feel it. Make sure you don't feel anything that feels like nodules or cysts there. If you do, you please seek medical attention right away, because It can be cancerous and it can be very dangerous. It spreads very quickly. So that being said, there is a part of it, a topic from this, from all the issues that I have mentioned, but very quickly, I'll run through like from a head to toe assessment of a woman's health. So you know, of course, your eyes, if it feels hazy, you can't see properly, or you're seeing double vision, or it's not clear, it's blurred, please seek medical attention. Even if it's itchy, or you have a boil, which is called style, you have it on your eye, please don't just say it's going to go away. Seek medical attention because it causes a lot of things. If you do not take care of it, there could be an inflammation that will start to go on in your retina, in which is behind the eyes that you cannot see. So please, please, please try and create time for yourself. I know me that is saying it. Like I said, I'm a mother of five. Honestly, it's our nature to be the last person to want to take care of themselves. So then, of course, your nose, if you are finding like the nose, the eyes, and the ears, they are connected. So if you're finding that you're having ear pain, or your eyes are watery all the time, or your nose, you have sinusitis, like when you're having runny nose, all those kind of things, please get it checked out. If two days, 48 hours, your symptom does not get better, always try and seek medical attention. Because sometimes it could be viral. Viral will come and it will go away. But then if it doesn't go away, you're having a cough that is going on for so long, now you're going down. I've already told you how to check for your thyroid to make sure it's okay. Then, of course, we know our gums. We need to, if you can, visit the dentist, but do your oral hygiene properly and you'll be okay. Then going to the organ that puts most women in trouble is the breast. If you, your breast, the best thing you can do is please Google it and see how you do a breast exam. But you do, you put your hand up here and then you palpate. You go like that, okay? So if you feel a lump, if you feel anything that is unusual, both of them should be equal. If one is, if you feel something that you did not feel in the other one, please, please, please seek medical attention. We have lost too many people as a result of breast cancer. Too young, too many people, too young, too late, which is very unfortunate. Sometimes it would already have spread. I have a vivid memory of one of our sisters that's, in fact, not even one, but the one that I know I was very close to that just died. We prayed and prayed and prayed. You know what God has his final say. So those things can be it can be prevented. They are preventable. I had a friend who was diagnosed even in Nigeria. Thank God she has the means to do it. So she went in Nigeria, they told her it was nothing. She went to South Africa because she could afford it. They said it's probable cancer. The next 4 days, she was on the flight to the US. So she went there, they did this thing, and of course it was cancer, and it was already stage 3. But you know, as God, yes, as God will have it. So she would have just gone to work one day, then come back, sleep, maybe not wake up. They will say somebody killed her. Please, there is no witch. There is witch, but if we are children of God, they don't have power over us. So, but we should also do our own due diligence to make sure that we catch the things that are coming up early. If it's your nipple that doesn't feel right, they should both look the same. They should be soft and pliable. Please, if they don't, seek attention. By the time it gets to the point of having pain and all that, it's already spreading. So it's a dangerous phase at that point. If it's your younger daughters, maybe from 16, 18, don't think that they too can have cysts, but in most cases in their own situation, in that age group, it's benign. It's because they are still growing. So the milk duct gets hypertrophied and becomes solid. So in that case, theirs is still good. It's very treatable. It's benign at that point. So they just take it out, and I think the best way I can use to describe is that you will feel it will be as hard as a kernel, like a kernel. I don't know how many of you will know kernel, but the palm front, what is inside, that's how it feels. So then going down to, well, your stomach and your pelvis, your stomach, if you're having acid reflux, which is heartburn, like people may describe it, please, 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 as a woman, it's not always just reflux. You could be having heartburn. Sometimes it's a sign of a very dangerous thing. You're having a heart attack. The woman does not have a symptom that is like the man. You know, this one you will see that when they're trying to describe heart attack, they will hold their chest and other. No, no. For a woman, it could just be a heartburn that you're having. It could be that you're having an arm pain. You could be having, your arm could be paining you. You're having a heart attack. It could be that, oh, you just say, oh, they're having pain at the back. Oh, it's just my back. I'm not sure whether it was from driving or something. It could be a heart attack, especially if you're hypertensive or if you have hypertension. But unfortunately, hypertension, most people don't know they are hypertensive because that's why it's called a silent disease. It's a silent killer. They will not know. They could just be going, they will not manifest anything, but most times you have a frontal headache, then that is when you know that until the headache doesn't go away, please get it checked out. I like to put on the lights here because it's getting darker. Okay, so that's one thing. Then when we now get to the pelvis, of course, arthritis and joint pains and all that, all those ones are things that are manageable by medication. But the ones that I want to bring our attention to is the one that is called pelvic pains. Pelvic pains, and the major one amongst those pelvic pains is called endometriosis. Endometriosis is a condition that causes severe, it's one of those causes of pelvic pain, and it's a very severe condition. So it's a painful disorder that is is associated with an endometrial tissue. Endometrial tissue, like the uterus, has 3 layers. It's the inside of the layer where the baby sits. It has a very special tissue. That is what gives rise to a period, a certain part of the certain time of the month. What happens is that our hormone grows, the brain will send signal to, of course, the ovaries and the fallopian tube and the uterus are the ones that participate in this. So your ovaries, you have millions of them when you're born. Eventually, they start to dwindle as a result of this menstrual cycle. So what then happens is that every month, as a result of the hormone estrogen and progesterone that is being secreted, the ovum becomes bigger, bigger. Then, of course, it ripens. It's like a fruit or a flower. By the time it ripens, what happens? It bursts, it ruptures, and then releases releases an egg in the ovaries. Then this egg travels down to your uterus. At that time, that's all that the ovaries are getting bigger. Your uterus too is preparing. It's getting bigger, it's retaining water, it's creating more blood vessels. And then when the ovary comes, and then the ova or come, which is one, ovum is one, ova is multiple. And the time it travels down the fallopian tube to get to the uterus, and there is no sperm to fertilize it, what happens is they will wait. After some days, then the level of the hormonal secretion will drop from the brain. When it now drops, what happens is that uterus, because nothing happens, because the endometrial tissue thickens, because nothing happens, then it will break. And then that's how you get your period. The blood is supposed to leak out. So when this happens, you have your period. The unfortunate thing that happens with endometriosis is that these tissues that are growing in the inner lining of your uterus, in some cases, some people, unfortunately, which is also due to no reason, anything that they did, they will have these tissues growing either in their ovaries or in their fallopian tube or even on their bladder or their rectum, like different parts of their abdomen can have it. So what did they do? Nothing. It's just an unfortunate thing that happened. So, but because those tissue, what they know how to do is grow every month when the hormones are being secreted, they thicken. They thicken, and eventually, if nothing, they would rupture. When they rupture, they bleed. So if they are in the fallopian tube and it's very painful, just like you're having your uterine muscles or your endometrium contracts to expel those blood and those extra tissues that thicken up during the process of this ovulation or whatever it is, or menstrual cycle, the stages of the menstrual cycle. These other tissues too, because they are endouterine tissue that grew outside in the wrong places, they too will be doing the same thing. So if it's in the ovaries, for instance, the ovaries is like this. It's like a sac that holds many, many little seeds. So if one of them, if the tissue is inside there that is not supposed to be, what it will mean is that when your uterus is thickening, this one too is thickening. And then eventually when the uterus ruptures, because the hormone level has depleted, what happens? This one too will rupture. The uterus has the ability, it's now expelling its own blood. What will happen? This one, because the uterus needs to contract to expel the blood, this one too will be contracting. And when it's contracting, it results to very severe pain. So with that, people will find that. So if you're finding that your menstrual cycle is extremely painful days before, during, or even after, some days after, you're still having these cramps, please, you need to seek medical attention. You may have endometriosis. So, and then what happens is that what is the cause? Well, like I said, it's not really your fault. Sometimes if somebody in your family has this condition, the person may get it. Then they did say that endometrial flow back, like blood flow, like during that period that you're having your period, because those blood has endometrial tissue, it's supposed to flow out. But if for any reason it flows back into the wrong places, then those endometrial tissues can maybe stick to some organs and start to grow. So that's why they used to say that you shouldn't use tampon baths, because if it seems as if it occludes the flow of or if you use tampons, you should change it often. You should change it often. So that one can also cause it. And then they said post C-section, like because they are cutting the uterus, then there could be an escape of uterine tissue that would then grow on the outside of the uterus. That's a result of that, or even grow on the scar. Then that becomes a problem. Person now will develop endometriosis, or even during a hysterectomy, they're trying to take out the uterus, and some of the tissue, for whatever reason, may leak into another organ, and then that could happen too. So which results to severe pain. And then because like I said, so how will people know that they're having this condition? It could be that they have painful periods. I already have explained what this menorrhea is. They will have the severe, it's called a pain that is associated with menstrual cycle. It's called dysmenorrhea. So they could have it before, during, or after. Then some people, they will have pain during intercourse. If you're having pain during intercourse, please, you need to check it out. During or after. It could be as a result of endometriosis, or there's also another condition that causes spasm during intercourse, which is a different thing altogether. Then if you're having pain with bowel movements or micturition is when you're having when you're peeing, then you should seek it out. If you're having excessive bleeding, like I said, during heavy periods or periods in between, or excessive periods or very painful periods, you should check it out. Then the major one, the most painful part, is the infertility, which sometimes endometriosis can be the cause of that infertility. Because it could grow anywhere, like in the ovaries. For instance, if it grows in the ovary and then every month it thickens and then bleeds, where is that blood going to go to? Nowhere. it will bleed inside the ovary, inside that sac that I said is holding the eggs. So when it now bleeds in there, what will happen? Eventually, the body will try to lyse some, but it may not be able to lyse all of it. So what will happen? It will become a scar tissue. It will cause adhesions. Adhesion, because what happens when there is blood, then the body will think, oh, there is injury. Then they secrete their own thing that will cause it to heal and all that. So what will happen is that those eggs, they will heal together. It will look like a band that is now holding them together. So what it means is now that the person can no longer release their egg, because they are in between scar tissue. So that could be a cause of infertility. So depends on where this is. It could be in the fallopian tube, it could be anywhere. So then other things, like I said, could be fatigue, constipation, bloating. You could even be having any of this. Nausea, that means like you feel like vomiting. Some people I know, then like if they're having their period, they will swim as if it's like a death time for them. So they need to seek it out. Then these are the symptoms, these are the things that you need to watch for. Then the next thing will be, what do I do? If you're having these things, so what do you do? Then you go to a medical practitioner. There are ways of to check out, which is diagnosis and treatment. They do have, they can do a pelvic exam. So they will do vaginal examination just to feel if there's any hardness, because all the reproductive organs, trust me, are very soft. They are soft, and you can measure with your finger the depth and their sizes. So if there's anything that is hard in there, because it's endometrial tissue will thicken, then they can feel something, or they can use ultrasound. They will use a transducer to capture the image of the reproductive organ, or they can do MRI, which of course will give a more detailed form of how the uterus, or what the uterus actually is like. And then they can do a laparoscopy. It's like the surgeon will now use under GA, they would use a camera to go through to see how the reproductive organ actually looks like. Then when they now find this, well, the treatment is such that they will be able to, they can like so many things. They can use medications to reduce the pain. They can put them on contraceptives to make sure that they secrete less hormones. They can reduce your period. Depends on the stage of life that the person is. But if it's infertility that made the person to come in, it's not just the pain, then they could do surgery. The surgery will be that they will scrape off all the those tissues that are outside of the uterus. They will look through it, and they'll be able to remove them. In most cases, some people are able to get pregnant. I think it's a high cost of infertility, because people would not ordinarily think that this may be the reason. They just think it's a painful menstrual period and thing, so they may not seek medical attention. So the chart that you brought about just now, I think we can now talk about that.
Okay.
That chart, yes. So I'll run through it quickly. I'm hoping that it gives you enough information. Yes. So this is the Ottawa Charter of Health. When I was saying just now that the health of a woman determines the health of the nation, this goes to prove it, that every nation is interested in the health of her women and children, because a healthy woman, honestly, is a determinant of a healthy nation. That is why there is a lot of emphasis on women's health and all that. So what I try to explain this chart by saying that there are also factors that of health promotion. So what is health promotion? Health promotion are the activities or legislation that is geared towards the overall improvements of women's health. So, and it sort of borders on responsibilities. Whose responsibilities are they? You have a responsibility, the community does have a responsibility, and largely the government has a responsibility. they have the largest responsibility of how the health of the women in their country will look like. And that also determines how their nation looks like. So like she said, if you see how the nation, I mean, when you look at the death rates, which is very sad, of women, or the life expectancy, especially during the childbearing age, which is this 20 to 40 window, is very sad. Women that still dies from childbirth or still dies from diseases that are supposed to be preventable. So, like I said, whose responsibilities are this? So the health of a woman, like I said, determines the health of a nation, or is the health of the nation. So there are personal responsibilities, like you can see there on the charts. There is personal, like under your personal one, develop personal skills. That's very important as a woman. If you find that the most or the educated women tend to take care of themselves more than the uneducated. I'm in the healthcare system. I've seen that. The educated woman is likely to seek out help when she finds, first of all, she has the knowledge. She knows enough what to look for and what to seek medical attention for. It's better to seek medical attention for nothing than to stay back and find that it's too late. Like that, my friend that I talked about, that I said how she got on the plane and then got to the US, eventually it was cancer. She got treated. 9 months later, she was fine, hale and happy. She went back home. To the glory of God, she's post 5 years. And with breast cancer, if you survive the first 5 years, it's called the survivor. That's a survivor. So it means the chance of it coming back and all that is almost next to zero. So the first 5 years is that is because she had the health, she had the education, and she had the means to do it. That's why she sought help. If it was a woman who couldn't afford anything, or who had no knowledge that this even exists, she would just feel it and say, it will go away. She might not even know about breast exam. So that would have been missed, and by now she would have been history. Thank God she isn't. So you need to develop your own personal skill. Like, you need to be aware of resources to improve yourself. Educate yourself, like schools, professions. Go to school, please. Train your children. I know that in developing world, girls are not they are not a priority when it comes to education. But please do not let this be your story. Empower the girl child. Positive attitudes to self-worth. Like I said, love yourself. Please love yourself. Doesn't matter. You're fat, you're skinny, you're green, you're blue. Just love yourself. You did not have any contribution to how you were created. God chose the body that He put you in. So please, it's not the container that matters most of the time. Is the content of the or that is within the container. So please love yourself. Do not beat up yourself. Do not beat yourself up, please. Love yourself. I can say that a million times. Because positive attitude to self-worth, your positive attitude to whom you are, that you project towards yourself, is what creates your self-worth, and it also leads to increased self-esteem and confidence. When you have this, you're less likely, it doesn't matter what anybody else says, you're less likely to feel the impact emotionally and otherwise. And you know that with emotional, the emotional implication on health is vast. Then I did say, like, there when you go, it says strengthen community action. And the community, you are creating a supportive community that has to, you too, you can contribute to the kind of community that you find yourself in. And community, like, not just, it could be your own, starting from your family, then your church group when you go out, your school, volunteer, do things to contribute positively to this, because what you give is what you get sometimes. So contribute to make your impact, contribute to the society that you live in, so that it will be a better place for all of us. Yes, welcome diverse people. Do not don't be prejudiced. Embrace people. And by the time you have different backgrounds, especially in this country right now that we live in, you don't have a choice. You can't be in isolation. You have to live with other people. And whether they are the people you like or not, they are there. So just try and be accepting, and let it be a symbiotic relationship, because there is nobody who is completely useless. Whatever you have to offer them, they definitely will have something to offer you too. Even if you are going to be mad at them, the fact that they are there, that you can be mad at them, is helping you to also release your own emotions. Then yeah, like I then said, when you strengthen community actions, like the church, you unite to grow a healthy community that I've already said, your school, coexist with others, encourage healthy practices, and then you at your own personal level, go to gym, go walking, join groups that are doing something that contributes to humanity. Make sure that the violence, do not tolerate it. Do not, that's a very another topic again, because it also has a lot impact on the woman's health. Then the government part is that when it talks about enabling, mediating, and advocating, to enable, the kind of society that you are determines what the privileges that you have. So the government should create an enabling society to encourage the practice of an enabled community, like, that increases health promotion. That would means like providing amenities and making sure that people get health education. There is library for people to get information. Like they said, information is wealth, and health is wealth too. So when you have knowledge is wealth. So when they have that, they are able to utilize what they have. And then mediating, he said there should be services to mediate between people, that will give out this awareness and the available amenities that are there, like social workers, community health nurses, immunization centers. Like they should, bring they should be able to liaise this community or connect these amenities with the people that actually need them. Advocacy groups, of course, we know what that is. There should be room for advocacy, like people should not be penalized for saying something, this is affecting my community. Get out there, do things that will make to be the representation of your ethnic group. It's not a bad idea if you do that. Join women's group, like anti-abortions, adoption agencies, health clinics. The government should provide these things, and they should also make legislations to make sure that these things are available and they are able to practice without prejudice, without criminalization. Health clinics, then health education, like I already said. They should make sure that people are able to access like legal options. Then non-profit organizations also should be encouraged. These are all the job of the government. They need to create that environment to make sure that all these advocacy utilizations or utilities are there. Then they need to reorient health services. This one, it means like, they should have situations where health talks like this, for instance, even though this is being done through a nonprofit organization, the Empowered Women's Network is the one that is conducting this today, is because the government, they make allowances for this kind of things to happen. So these situations like this gives avenues for people to gain awareness of what they should do and where the health services are. So the government should create a situation and provide professionals that can give health talks in schools, in churches, centers for rehabilitation, like people who want to quit smoking, like AA, people who wants to stop drinking. These are the things, these are parts, they come under reorientation of health services. Like people could be living in the community, they don't know what health services are available there. Then the other one, this is still the government, they should build healthy public policies. they should not be putting up policies that only favor a certain group in the society. They should put up policies that will create equal accessibility to health and healthcare and all these things that we've talked about. Anybody and everybody should be able to have access to that. The government should aim at creating policies that fosters the health of women and funding women programs. So when these are done, well, we can say this because at least we thank God we have the privilege of living in a society that when you speak, you get heard. When you have an opinion, people will actually work with it if you are able to spell it out. So another thing that we have been talking about, I can't remember the person I was talking about it with, is that we should strive as women. We should be where these policies are being made. If we are not there, then of course, when they are making these policies, you're going to tend to be excluded. You're going to be marginalized. But if you have women with strong voice because they have education and they are confident in themselves and they're able to bring these things forward, they can be very loud. And trust me, they will listen, and it will be a vicious cycle, in a good way. That my children, your children will have a better society to live for it. So thank you today for having me. And like I said, there's too much about the woman that we can go through. But in a nutshell, I think this is what I've been able to bring to you. And there is a whole, like the mental health is a different branch altogether. So trust me, if we are to talk about just the eye, we can spend months talking about it and the diseases of the eye. So I'm hoping that after today, you are able to take little things seriously, and please look after yourself. I know I say it, but you know what? It is a thing that we don't hear enough. We need to not always be the last. Yes, put yourself last, but remember in a plane, when you have a child and you have yourself, well, what do? They tell you if the plane is going down, or for whatever reason, there's bad turbulence and the oxygen tank drops, the oxygen mask drops, they tell you to put the mask on yourself first. Because if you do not put it on yourself, that child is not going to have anybody that's going to care for them. So always remember that. Try as much as possible to remember yourself. You are a caregiver, but please do not forget yourself in the process. Thank you very much.
Wow. Man, that was exhaustive. That was great. You see, they're already giving you kudos. Lots of clap. That was really, really good. Well loaded. So I am going to pause the recording so we can have question section.
Sure.
I'm just going to start recording.